It's been a wild few weeks. It feels like it's been an eternity.
Just a few weeks, are we sure?
It's just been a few weeks. It really struck me in my heart that one of the first actions that President Trump took upon assuming the presidency was to sign an executive order that was freezing all foreign assistance around the world. I know that Marco Rubio kind of walked that back and said life-saving programs can continue, but of course, since then, we've actually seen Trump go farther, not only freezing, but cutting off completely grants that save lives, and really challenging some, I think what we've seen is positive movement in the courts to dare him to have to respect the constitutional separation of powers, because of course it's Congress's authority to authorize funds, to authorize programs, et cetera. I'm glad that we'll be able to talk about PEPFAR and the global fight against UNAIDS today, because that is a program that has been popular for decades. This is a program that President George W. Bush started in 2003. It's seen bipartisan congressional support to continue to reauthorize it, to continue to fund this program because of its success. It's saved over 25 million lives around the world since it started. And of course, that's had an impact on the global fight against AIDS, including here at home. We even saw hope that we could reach by 2030 the total eradication of the HIV/AIDS epidemic worldwide. It's really tragic that now we are thinking about how those efforts are going to be rolled back, but I'm glad we'll have some time today to reflect on the success of that program, why that's so important to people all over the world, and why that's so important to people here at home.
Yeah, it's really, it's been really hard to watch. And like you said, this program has been so successful. It's really well supported with bipartisan efforts and has been for years. I think it's important to note that not only are these programs treating folks who have already been diagnosed with HIV or with AIDS, but it's actively preventing new diagnoses, new infections, and continued spread of HIV and AIDS. Not only are folks who are currently receiving treatment at risk for serious illness, and like you said, we are likely to see potentially millions die because of this, but we're really likely to see additional folks at risk for contracting HIV and AIDS globally, and really that impacts folks not only internationally but here too, which is really scary.
Yeah, absolutely, and I know that the fight against HIV/AIDS is one that's been really rooted in the LGBT community organizing throughout the 90s, putting this issue on the agenda at a time where this was a pandemic in the United States. This was a pandemic that was claiming lives all around the world. And I know that that's something that you're, have had top of mind. And it's just, thinking about how much progress, so not just since the program began in 2003, but really the decades of organizing that needed to happen before that, and thinking that we are now not just going back potentially 20 years, but actually going back potentially 30, 40 years to where we saw the AIDS pandemic really crippling parts of the U.S. society.
Yeah, one of the last things that we saw from the Biden administration was the hosting of the AIDS quilt on the White House lawn. And the AIDS quilt tells the stories of thousands of folks who have died due to HIV and AIDS over the last several decades. And it is a really physical testament to the incredible, overwhelming work that went into just getting a government to listen, let alone start providing support and treatment. And it's something that, obviously HIV and AIDS does not only impact the LGBT community, but we also know that the LGBT community really saw a generation lost to HIV and AIDS, and it's something that is still so central to the community. Caregiving and taking care of our family and our neighbors is so much a part of the fabric of the community. And I know so many folks who certainly see the loss of PEPFAR and see the loss of these programs for the risk that it is, because we've felt it, and know the harm it will do, but also just feel the real loss, I think, personally in the community. I think it paints a picture that this is one of the first programs to see cut, that there's, I think, an implication that people won't care, right? That people are uncomfortable talking about HIV and AIDS, that people maybe still have some sort of misconceptions about who HIV and AIDS impacts and who it doesn't. I think, as we were saying, right, that a lot of these programs are preventing babies from being born with HIV, and how many folks in and outside of the LGBT community that this really does impact. And it feels like such a blow to the history of the LGBT community to see these programs so easily and summarily wiped out. People fought for years, people died to ensure that other folks wouldn't have to go through what we wouldn't have to go through what we now are seeing, especially when it's preventable, especially when, you know, when these first real major efforts happened without treatment, right? Without understanding how we can stop HIV and AIDS. It feels even harder now because we have the answer, right? We have clear treatments that are cost-effective and efficient and helpful and safe. And to see an answer be available and not provided is really devastating for so many reasons.
It seems like the Trump administration is making a bet on who Americans think is worth standing up for and who Americans think is worth investing in. And we saw this during the address to Congress, where Trump was sort of ridiculing foreign assistance programs, saying that these are like trying to make mice transgender, which, you know, I think is either and probably is at best total misunderstanding of these programs and what they do, and at worst a deliberate attempt to misdirect and misinform the American public about where their tax dollars are actually being spent, as you said, in ways that are cost-effective, life-saving, and have benefit not only abroad but at home. It seems like PEPFAR and UNAIDS sort of fits in this Venn diagram of the Trump administration picking up this long-standing far-right kind of extremist culture war attack on quote-unquote DEI, which we really know is attack on people who are LGBT, black, brown, right? Like anybody who is not fitting into their culturally pure conception of what an American is. It fits into this far-right anti-reproductive health care / anti-abortion agenda. Mm-hmm. And of course, this isn't the first time that we've seen PEPFAR come under fire. When it's come up for congressional reauthorization in the past, we saw some of these extreme right-wing members of the House try to take it down. So it fits into this kind of culture wars trend that we're seeing in the administration, and also this gamble that they seem to be making that Americans just don't care about America's role in the world. They don't care about foreign assistance. They'll see these things as a bad deal, as Trump likes to frame them. I tend to think that they're betting wrong. again, I think the fact that PEPFAR has had a durable bipartisan support, that it has delivered results, that it has saved lives all around the world, and that, as you highlighted, in bringing down the rates of infection and transmission, death, suffering due to AIDS and HIV, we've actually seen similar trends here in the United States. And the other thing, that we can point to is that these programs have invested not only in saving lives, but also in building up health infrastructure in countries that are then better able to deal with other infectious diseases. So it's benefit people all around the world. It's benefit people at home. And I think that's why we've seen some of this strong pushback in the courts. We've seen many congressional leaders standing up for these programs. And actually now what we're seeing in public opinion research is that people are not in favor of just slashing willy-nilly programs that deliver great benefit to them. I guess the question is sort of where will things go from here, particularly that it seems as though the administration is really dedicated to testing the limits of the executive prerogative, really challenging Congress' authority to appropriate funds and to authorize programs. And again, the tragic thing is that people are dying right now. So while we are figuring out here at home how we can continue to preserve the constitutional separation of powers and democracy, all around the world, babies are being born with HIV and AIDS. It simply didn't have to be at all. And all of this just comes down to the president taking a gamble on what he thinks that he can slash and burn.
Yeah, and I think that the implication from the administration, and certainly the narrative around this, is really naively assuming that millions of people can die from HIV and AIDS, millions of new folks can be contracting HIV and AIDS, and that somehow not impact Americans. I think, and people here. I think that when we see a global rise in HIV cases and AIDS cases, we're going to see that here as well. Many, many people in the US receive care for HIV and AIDS through publicly funded sources. We know in the LGBT community, folks tend to be lower income, right, than our non-LGBT counterparts. We tend to be more reliant on publicly funded medical care. And what we know is so true about care for HIV and AIDS is that consistency is key. Very soon after treatment is stopped, we can see really drastic decline in rates of treatment. We have something in HIV and AIDS communities called U equals U, which is if you are undetectable because you have so consistently received treatment, you cannot transmit HIV to other folks. And where we see more folks who are not detectable, their viral loads are so low that they're not able to transmit HIV, that's protecting that community, right? We are now going to see more folks who are no longer undetectable. And I think that it's naive to assume that if we're seeing more folks who are transmittable in other parts of the world, that doesn't translate to more folks here. There's so many different assumptions being made very quickly by the administration that these things won't impact us, that if it does, people won't care. And as you said, at the same time, as we're figuring this out, people are actively being impacted by this, and that dichotomy can feel really scary and overwhelming, I think.
I'm really glad that you brought up the community impact and kind of the global impact, and remembering that like our communities are situated within a broader globe, because it does really concern me what the longer term effects are going to be. I mean, it's not only here in the United States that those who have HIV/AIDS depend on publicly funded programs, again, all around the world, particularly in places where there is high incidence of HIV and AIDS. These are often countries who are otherwise quite poor and who may not have the kind of national budget ability to fund adequate mitigation programs, and so who really rely on the partnership with the United States to be able to provide care for their citizens. There's many countries in Africa, and South Africa particularly, I think the numbers are over 50% of the HIV/AIDS infected population or at-risk population that depends on PEPFAR. And so as we think about these people who are reliant on these programs getting sicker and sicker, we also have to think about the capacity of national governments around the world to actually be able to provide care and services. That can place real strain on national budgets. When we see strain on national budgets, we see that there's less ability to invest in other areas that keep countries and regions stable. So I do worry again that this is going to have real impacts, not only as we think about the cost of lives, but as we think about economic impacts. We have fewer people who are working, particularly women and girls, who tend to be disproportionately impacted when you have a community that is suffering. Women and girls tend to have to be the ones who stay home and caretake. They're less in school. So we just see these compounding effects that, again, I think any week, month that these programs are cut off now, it's going to cost years of potential harm down the road. And as an American, that's not a world that I want to live in, one that's less stable, that's less healthy, that's poorer. And so I really think about this as, we are spending such a minor proportion, out of our taxes that actually goes to these life-saving programs that brings all of these kind of benefits in making the world a healthier, more livable, prosperous place. And we all benefit from that. And it just seems to me that there's just such a real value in these programs.
The longer that these programs are paused, the harder it's going to be, and frankly, the more expensive it's going to be to fix it once we are realizing we need to do so because the epidemic has increased in volatility so much. We know that that's an eventuality, that will happen, that we will see that volatility increase, and we're going to want to fix it because it's going to impact us and it's going to be harder and cost more the longer we wait here. For example, something that we've seen even here in the US is that climate change really increases the risk of HIV prevalence and transmission because after climate disasters, it's harder to get folks their medications, they may lose their medications, and like we said, consistency is so key. So as we have more climate change, as we have fewer public programs supporting our folks, this is only going to snowball and get worse until we decide to fix it. And I'm definitely nervous about what that will look like when we do decide and are able to fix it. And I know that, as you've mentioned too, there are active court cases here that are really litigating the ability of the administration to actually do this. I know that there are so many folks in the LGBT community, in the health community, in the disability community that are really hard at work to advocate for this so that we have as minimal as possible interruption to folks' care. We won't sugarcoat it, but the risks are really real here and folks will be impacted. And I've been really heartened to see the just mass activation of our communities because we remember what this is like and we know the real impact and danger here. I think folks are really also willing to jump in and tell our administration that this is just not acceptable.
It's such a good call to action. We need to keep speaking up, using our voices, making sure that this administration knows that the actions they're taking are not acceptable, that they're not popular, and that they're just not okay. So really appreciate that we were able to have this discussion today.